In 2020, we saw digital health move faster than ever before. But at what cost? How much do you know about the technologies transforming our world? Join us as we build our cyber consciousness.
Thinking about all the panels and conferences that I attended, we were invited because we were a fresh and live use case in the space. And like you said, even if it's a pilot, that's what we need more of. We need these use cases, even if they're short-term projects, to be able to, to show people that we're actually, putting all these ideals into practice. And so I'd love to hear from you any use cases that you're directly involved with or that you know about and you celebrate.
There is this organization, it's called Simply Vital Health, and they're actually completed that in 2019. And you can find these projects through the Connecting Care. And according to their CTO, it uses care coordinations and financial forecasting to help providers to bundle payments to get insight into what happens when somebody is released from the hospital. And it's actually currently on the market, helping healthcare providers determining how much a patient's care is going to cost them when bundled with multiple organizations. And what they're doing is, as soon as they released it, they got the data and they collect them on the blockchain and determined what was needed for the next project. It's called the Health Nexus. And Health Nexus stores a patient's information on a blockchain for all of the parties to view. It will also possibly allow other parties to sell their data for the researcher. During this time of coronavirus, I think so many people are admitted into the ICU, and there was a cost associated with that. When people have to go back home or their families has to be in quarantine, there was a huge economic cost attached to that. Or people who can't work, for critical illnesses, the medical care, if they need physiotherapy, there's many different aspects of it. It's just not a hospital care that people need. And I think from a financial point of view, having that use case really empowers people. They can understand what it might cost them, going forward. And since this is allowing them to also sell their data, and I think I really like this idea of, through social media, other people taking my data, then I'm being given a choice. Like, you know what, I can sell my data and I can be paid for it. I think it is a democratic way of dealing with data. And that is one of the reasons I really, really love blockchain. So I really like that use case because it's simple, but it's effective and it is really, really necessary.
No, thank you for sharing that. And I think you've touched on the most important use cases and categories in healthcare, right? Medical billing, data management, and the other one that can be very much advanced and supported by this technology is clinical trials or research in general. And that's something that we're up to. We have this end-to-end solution that allows researchers to more easily collect data, and like you mentioned, through consensual practices, actually asking through smart contracts, asking people for permission to use their data that they've shared by participating in a study. And what we've seen is that when people are asked for permission, generally they're happy to share their data for research purposes, which is amazing. And so it's, at the end of the day, it's really just empowerment, right? When we're empowered humans, we're generally wanting to, support the collective. And I think we all understand that, healthcare impacts all of us. And so I'm really excited for the clinical trial space as well to get hopefully advanced through this technology. And I think the industry as a whole, but like you said, having these use cases that are very specific and focused is the way to go, right? Versus saying that we're going to use this technology to now, uplift the entire industry. That's never going to.
No, it doesn't work like that. Technology is not really meant for that, it's just not.